Hey everyone, Sheriff Kozak here from the podcast. Although we're right next to the pod, we're in the detention deputy briefing room. Perry, you want to introduce your guest to us?
Yeah, hey, great. Welcome, everybody. This is Dr. Tatum. And so Dr. Tatum's with our medical provider, Med Health. And so he's here from Atlanta working with us to try just improve our capabilities and response to dealing with mentally ill here at the facility. So he's here doing training with staff. So one of the things that came up, it came up during the election. It was discussed then, but also with our own staff of being better equipped and better trained to be able to handle and work with the mentally ill that we deal with, because our numbers with the mentally ill continue to rise. And so, Dr. Tatum, why don't you just kind of share a little bit about, how did we get here as a community, with which all communities are facing, and a little bit about the training yesterday, and what we're doing here and how we're trying to make a change in dealing with and working with our mentally ill here in the detention center.
Well, certainly, I'm real excited to be here. I thank you guys for your forward thinking. It just doesn't matter what size facility, doesn't matter what state we're in, what county we're in. We're at a point right now in the United States where your county jail is your largest mental health facility in that county, without exception. And so your county is no different, and you've recognized the need, and the need has been growing and growing over the years. We had training yesterday because we wanted to introduce the staff, the frontline staff, to the idea that what they're looking at many times is behavior, but many times it's illness. And knowing the difference makes a difference in how you approach that person, how you manage them safely and effectively, and it's best for the community, because good jail health is good community health.
Yeah.
Because everybody's getting out at some point, and we want to return them better than the way we found them. If our staff on the front line know what they're looking at and understand, and yesterday we covered basic major mental illnesses, the diagnostic criteria, and we also covered the de-escalation techniques that work best depending upon those specific illnesses. It was a great class. The class was engaged. I think they got a lot out of it, and we were very pleased with it, because the questions I was getting from the officers let me know that they see what's going on and they want to know what they're looking at. And I've seen this across the country. I've worked from coast to coast in this environment over 34 years, and I can tell you that the anxiety level of the officer goes down when they understand what they're looking at, what they're dealing with. Many folks signed up for law enforcement. They want to work in the jail, but they didn't know they were going to be a frontline mental health professional when they signed up.
Yeah.
And so we owe it to them to prepare them and give them the tools they need to do a safe, professional job, and they're eager to receive that knowledge.
Yeah.
Yeah. So, Doctor, we're creating a mental health pod essentially. So, what do you think, is that going to help us to better manage that population?
Absolutely. I'm real excited to be a part of that. I've set up those types of units in other places, and we are the hospital, and anybody who doesn't understand that needs to know one particular stat. In this country right now, there's over 700,000 severely mentally ill people locked up. At the same time in this country, there's only 59,000 severely mentally ill people in mental hospitals. Okay, so that answers the question, do you need a unit?
Yeah.
Okay, so now if you're going to have a unit, all right, you want it to be a therapeutic unit. You want it to have a purpose. It's not just a holding place. It's a place of transition, a transition from instability, emotional, mental, to stability. Mm-hmm. Okay, because that affects recidivism of that individual. We want to get them ready before they leave, because we know that the longer that gap between the last day of treatment here, proper treatment, which we will have, and the first day of treatment on the outside, the longer that gap, the higher the recidivism of that patient.
Yeah, very good point. So again, that fits in with our plan. We also want to connect inmates when we release them to resources in the community,
Correct.
so we can hopefully keep them from coming back to jail. So again, I think that you have anything to add, Perry?
No, and thank you, Dr. Tatum. I think that really sums it up well. We are really working hard to serve our community in the best way that we can and care for the people that are here at the Laramie County Sheriff's Office.
All right, from another podcast, signing off. See you later.